Yes. I have my whole life struggled with respiratory issues. I was never diagnosed as having asthma, although I still think back to this ridiculous doctor at one point when I was a teenager who said, "Oh, you have COPD," and then like never said anything else about it. It's like I think back to that and I'm like, what
But
an
that's
odd
an
thing
awful
to.
statement to say to somebody just off straight
I
off
was
the
like
bat.
18 and I'm thinking, and if you really believe that to be true, did you not think that there was something you should, but the reason was because I coughed all the time. I never wheezed, but I coughed all the time. And so I was my, I when I had a lot of strep throat and tonsillitis. When I say a lot, and ear infections, like almost every other week, I was on some kind of antibiotic. I was sick all the time in the winter.
And can
It
I
was
ask, were
just,
you a chronic mouth breather? Do you think?
oh yeah, yeah, I was for sure a chronic mouth breather. And my brothers, I had my adenoids out, not my tonsils then, but I had them out later. But I had my adenoids out when I was 4, and I had older brothers, and they used to tease me about my snoring.
See, this is really interesting because just before we got on, you were talking about having work done and you've had your lower jaw, I'm
Upper
assuming
jaw,
your upper
the
jaw,
whole thing.
your lower jaw, all widened to help open up the airway. And then you talk about having enlarged adenoids, which of course is the lymphatic tissue at the back of the nose. So just in our little model here,
Yeah.
it's this tissue here that's enlarged. And when this is enlarged, well, the child is not going to breathe through the nose. So therefore, with Robin and with many, many children, their adenoids are enlarged. They don't feel comfortable breathing through their nose, so they breathe through their mouth. And this causes a huge impact on the craniofacial development that lasts lifelong. And even this should be put into yoga students because how many of
I
them have their own
know.
kids?
I know. I mean, because of all that I've gone through with the breath transformation, and we'll get into that, like how I shifted from traditional pranayama to incorporate so much of what I've learned from you into understanding pranayama, like really understanding pranayama, and then transforming how I teach breathing. But then the reconstruction piece, because I mean, I did transfer, I'm not a mouth breather, and I have a very, very functional breathing, both biomechanically and biochemically, but that was not going to change the deforming of my right, of my jaw and my throat. It was not going to increase my airway. I had to actually have structural surgery, multiple surgeries to do that, and I still have aligners, and I have 3 more months of them. But I
You've
mean,
three more months
of wearing aligners
aligners.
to, yeah, yeah. My jaw's where it needs to be, but my bite isn't.
Yeah.
So they're refining my bite now so that I can actually chew things like salad and apples and carrots and things. I can't
The
do that.
sleep in women, and I'm only starting to do a deep dive in it because I have a book due that has to be written by January. Um, and sleep in women, Dr. Christian Guilleminault, who's a really important figure in sleep
Right.
medicine, he said that women were the forgotten gender, that a lot of the focus is on men. Now, you talked about your small airway, so you're talking about the space at the back of the nose and at the back of the mouth and the throat itself. And if you have an airway the size of a big biro, regardless of what you're doing, air isn't going to travel so freely. But if you go and do a sleep study, it doesn't necessarily register as having moderate to severe sleep apnea. But here's the thing with women that I only came across recently. If a female has an AHI, which is a measurement of the severity, between 2 and 5 events per hour, which is nothing. Well, is it? It's equivalent to men with an AHI of 10 to 15 events per hour. And females respond much differently with their sleep issues different to men. They're more likely to have stress, anxiety, panic disorder, probably craniofacial pain and other aspects going on. And this often goes under the radar. So, Robin, when we're having this discussion, we're a lot of people who could be attending yoga, of course, for high stress levels, poor sleep, and they're getting that help. But then we have to ask the question, how are they breathing and how is their airway?
Exactly. Exactly. And and so I since working with Pippa, which people are like, well, who's Pippa? She's a wonderful person who was a long time yoga student of mine and had severe asthma. When I met her, she never was without her inhaler, like rested on her mat because she was having horrific attacks and would end up in the hospital regularly, in spite of being on very high doses of all the medications. And so at some point, her pulmonologist suggested Buteyko breathing. And she reported back to me and said, I'm doing this breathing. It's making a huge difference. I've been able to reduce my medications. At one point, she was off of them, went trekking in Nepal. I mean, she's an incredible woman. And I watched her go through that process. And she said, I'm no longer going to breathe the way you and the other instructors are instructing in class. I love your classes, but I'm going to breathe in the way that works for me. And I said, God bless you, please do. Right. And I was, there was that little inkling of curiosity. Like, I wonder what she's doing that's so different.
You weren't insulted though, no?
No, I don't get
You seen her
insulted.
struggle.
I get more curious, but I do get arrogant. So that did come into play. So I invited her to come and do like a little info webinar on Buteyko, and she did, and I was really fascinated. And I thought the information was really interesting. I even brought the whole idea of the CO2 syndrome into my yoga therapy training. But this is where the arrogance came in. But I did pranayama. So like, I didn't need that. Like, I was good with, like this ancient teaching about the breath. I felt like I was in good hands, had studied with these wonderful teachers in the yoga lineages who really knew deeply what they were doing. So I just figured that was all good. And I didn't need what she was offering, because at that point, I had never been diagnosed with asthma. And my coughing was, my health was good. My energy was good. My coughing was pretty mild at that point, but then I started teaching more and talking more, and there was more stress as a result of a variety of family health issues all around me with my mom, my husband. Anyway, a lot of different things kind of came together in a perfect storm where I started having the health issues that I had when I was growing up. I was coughing all the time. I was tired. I was weak. I had brain fog. I couldn't stop yawning, like all of these things. And I started getting respiratory infections and not being able to like fight them off. And I'm thinking, this isn't right. Like, I'm going backwards. Like, I came so far with my health and now I'm going backwards. I don't know what's wrong. And then I went to my naturopath and she had me, breathe into the spirometer. And she was like, oh my God, Robin, that's horrible. You have asthma. I'm like, I do not. She's like, no, really, you do. This is bad. You need like inhalers. You're not gonna, like, you need steroids. Like, you need help, lady. And of course they did help. I'd never used an inhaler in my life. Like, and I had so many coughing jags for like 20, 30 minutes, like horrible. I've cracked ribs from coughing so hard. So anyway, that got me thinking, the asthma piece, like that she labeled that, it was like, oh, I better call Pippa. It's like immediately, like, I know where to go. I've got to go outside my wheelhouse because obviously everything I've tried isn't working. And I don't want to be on meds for the rest of my life. Like, something here is off with my breathing. So I started working with her, and that, opened a whole new world. Like, everything I learned in yoga school about deep, big breaths, like really expanding the chest and the ribs and like, right. And, we weren't actually exhaling through the mouth, but back then, nobody did that back then. That's a new made up thing that none of my very, very knowledgeable and deeply studied yoga teachers ever taught. It's a new thing. Like, new as in, I've been practicing for 40 years. None of my teachers in the first 20 years that I was studying regularly, intensively training, nobody ever said breathe through your mouth, ever.
Wow.
It's a new thing, and yoga people, stop it now. It's not yoga, it's not pranayama, and it's not healthy. Patrick and I, both of us, could go into a long lecture on why it's not healthy, but please stop it.
Absolutely. But I'm kind of a little bit intrigued by that. I find that amazing. Now, what's coming into my mind though? So you then switched to Buteyko. What was the difference between the Buteyko method and the pranayama that you're teaching? And then the second question that I'm going to ask is, was original pranayama closer to Buteyko than we think?
Yeah.
Did it
So
get lost?
this is actually the reason why I wrote the book, as you know,
Yeah.
and so I'm happy to share this. So first of all, what happened to me was literally like night and day. So before I went to see Pippa, it was on a Monday or something, like, let's just say it was Monday. So Saturday, Sunday, and for the 3 months before, I actually had not had a solid night's sleep because I was coughing all night long. Like literally, I tell my husband, go sleep in the guest room because I'm just going to keep you up. I can't, I would have to sit up, and I would be sitting up trying to do different pranayamas to stop the bronchial spasms, to stop the tickle, trying everything I knew. And I was just getting more and more exhausted. I was having these horrible coughing jags. Like I said, like I had like the symptoms of chronic fatigue and fibromyalgia, which had, like chased me my
This,
whole life.
Robin, I'm going to step in, as well.
Yeah.
Sorry now, because when you mentioned fibromyalgia, that was actually one of the symptoms of upper airway resistance syndrome, which is tying in with your small airway. Plus, you had
Yeah.
breathing issues and you
Yeah.
had mouth open and things like that.
Yeah.
Um,
Yeah, exactly. So of course, I didn't correlate. I came to correlate it all and be like, oh my God, this is what's been like all these different problems throughout my entire life could go back to, and I'm not blaming my mom, but like not being breastfed, like, and not developing my jaw, my tongue, and all these things that we know now are so critically important to health and well-being. But that's just the way my life was set up. And then my dad was a doctor, so prescribing antibiotics was sort of what you did if your kid's sick, and I had all these infections. And so he was doing his best too. They didn't know, right? And meanwhile, feeding me, milk and toast, gluten and dairy in large quantities. And, it's just like, anyway, all not good. My gut biome, everything was just going in the wrong direction. So I can put all those pieces together now, and am happy to help others to not fall down that toboggan run, or have their children go that route too, right? Through education. But in any case, I was having all these symptoms, a lot of brain fog. I mean, it was scary. It was scary to feel so awful again, to wake up and be like so achy and not tired. I mean, wake up, I barely slept. So I go and I do this 2-hour class with Pippa, and I do what I breathe in the class the way that she's telling me to breathe, which is like very little, like tiny breath. And I'm doing these breath holds, and I don't know what it does. It's like so bizarre, but I'm fascinated because my curious mind, like, this is so bizarre. Like, I'm doing this thing and I'm feeling better. Like within 24 hours. I mean, the story. My husband literally said, he was sleeping with me at that point, and he said, "You scared me last night." I said, "Why?" He said, "You were so quiet, I thought you were dead." Literally, because he was so used to my snoring and my noisiness at night, hearing me breathe all night, and then I was so quiet. So it was dramatic. So within a week, my coughing had reduced by 75%. And when somebody, please understand, if somebody's got a chronic cough, it means their insides are being violently agitated, irritated, and inflamed from top to bottom, and it's damaging. I mean, I will go into it as detailed as you want, but honestly, I've had multiple surgeries as a result of chronic coughing. It's not something that you want to just let go for yourself or anybody that you're in contact with.
yeah.
So anyway, so the not coughing was huge for me, and I started feeling like my brain was clicking on all cylinders again, and I had energy, and I was sleeping better, and I'm like, okay, I need to understand this, right? So I'm like, Pippa, I need books. I want to understand it. So second class, literally, it was a 5-week series. Came in the second week. I need more information. So she gave me some books, and I'm like reading books, your book. And I'm like, I gotta train in this. I have to understand the science behind it. I've got a science mind. So I'm like looking, and your training was like in April. I'm like, I'm going to Ireland in April. I'm going to study. I don't know who this dude is, but I'm going to go study with him because he seems to know something about this. I'm going to go there and I'm going to learn more about this. And by the time I got to you, I was already much healthier and much more functional. And then, of course, you just, brought so much rich information to me. I was just flooded with all the things that I didn't know about breathing. And I was working with people with severe chronic health issues. And I was teaching breathing. And what I was learning from you is everything. And I was teaching yoga teachers to use those same techniques that I learned from my teacher that hadn't worked for me. Yeah. Right? I mean, worked to a point and then didn't work anymore. So then I'm sitting in your office as you're going through these PowerPoints and showing all these studies that have been done and all this stuff about the airway and the chronic inflammation and CO2 levels and nitric oxide, which I've never heard anybody talk about before in all of my trainings. And I'm like, I have to learn this and I have to share this with the yoga community, because how can we call ourselves breathing experts and we don't know this stuff? And I was honestly, I'm going to be a little bit, I'll bring my arrogance back for this moment. I studied with the best yoga teachers around who really had studied deeply with teachers in India and took this whole therapeutic understanding of yoga very seriously. And they were not teaching what I learned from you in terms of the science, respiratory physiology, the science of the breath, and what functional breathing is and what constitutes functional breathing. So it's learning pranayama, but not from a place of understanding what's health, what's healthy breathing. And the pranayamas are manipulating the breath in a variety of ways, which the yogis were doing, but they had very different lifestyle. And my contention is they were functional breathers, so they could do all kinds of stuff, right? They could manipulate and have different experiences as a result of where their starting point is. But if you're starting with people who are highly stressed and people who aren't sleeping and aren't digesting and have chronic pain and chronic health issues, and you have them do these extreme breathings that are manipulating their breath in a way where you're taking them from dysfunction and pushing them more into dysfunction, it's going to create more health issues, not take them in the direction of health. And this was my big fear. As I'm listening to you, I'm like, oh my God, we are in trouble here if we don't get our breath facts straight. We have to learn about this so we can actually utilize some beautiful tools of pranayama that refine what I've learned from you in a even more exacting and adaptive way. There's a nice blend there, but you have to understand and get people to functional breathing first.